Welcome to Paul's Heart. I'm Paul, author of the book Paul's Heart Life as a Dad and a 35-Year Cancer Survivor, available on Amazon. How do you think a cancer patient would feel if the doctor came into the office and informed you, the patient, that your treatments were going to have to be delayed temporarily, but delayed because your blood counts were too low? Devastated, right? I know it happened to me. I had my calendar marked when my last treatment was supposed to be, and I was looking forward to getting my life back on track, back to normal then. And it wasn't going to happen because I got sick and my treatment had to be delayed. Let's ask a different question. And this is a legit question that actually came across my feed. Can I take time off in between during my treatments to allow me to take a vacation? Now, again, not a bad question to ask. You know, those of us who've gone through chemotherapy or radiation therapy, these are difficult treatments to get through, especially emotionally. And no doubt, some time off would allow us to maybe rejuvenate ourselves, boost our attitude a little bit. But the question really shouldn't be can I, but should I? Now, there is an importance of consistency with your treatments, getting them every 2 weeks or whatever your scheduled round is. There's a reason why that plan is set up that way. Okay, the intent is to not only put you into remission, but to keep you in long term remission. Now, I'm notorious for explaining to people uh, when it comes to dealing with chemotherapy and we get told that we're in remission halfway through, do I still need to finish the rest of the chemotherapy? I like to use antibiotics as an example. Say you have a sinus infection or something else like that, and the typical doses or prescriptions you get say for like 10 days. But by day 3 or 4 you're feeling better. So you quit taking it because you don't need it, you don't feel like you want to take it, so you stop taking it. Most likely what happens? It comes right back. So, just as I tell patients who want to bail on the plan to finish chemo just because they're told they're in remission halfway, you need to see the whole way through. The idea isn't just to reach remission, but to stay in long term remission. Remember, Mr. 35-year guy? I'm actually 36 years in remission now. My book is 2 years old already. Okay? But I know something about having to finish the chemo. So, no, I'm going to be a fuddy duddy. I don't think it's a good idea to voluntarily take time off from having your treatment as scheduled to go on a vacation. A couple reasons why. Most notably, it interrupts the consistency of your treatment plan. Also, say you go on vacation and you're exposed to anyone who's sick and you develop that, whatever they have. That's going to delay your treatment even further. Now, it's different. Things come up. I get that. You could have a death in the family with a funeral that happens smack dab in the middle of it. There could be any other circumstance that comes up that's unavoidable, that you don't have a choice. Emergency trip to the hospital, things like that. But yeah, I'm not going to be a fun guy and say, yeah, go for it. It'll be worth it. No, I'm not a believer in that. And I'll give you one example, and it's in my book. I talk about wanting to go skiing. There was a time long ago that I was an avid skier, and I was being treated through September of 89 through March of 1990. And it was around January. Obviously, great month to go skiing. Asked my doctor, hey, is it okay for me to go skiing? And his words to me was, I don't see why you can't, but the question is, do you want to? Because I'm assuming that when you're skiing, you're bundled up really warm. You got nice warm clothing underneath. You're going to be sweating probably. And of course, out in the cold, you stand a chance of getting sick. And then, of course, there's all the other people in the lounge that you're going to be hanging around with. Okay. You really want to risk that? If you come home sick, we've got to delay your treatments. Now, to be upfront, that's not why my other treatment that I mentioned got delayed. It got delayed because I got the flu from a coworker. But I listened to my doctor's advice. I did not want my treatment being delayed. And to have it delayed and then a month later have the flu and have it delayed some more, I don't think I would be celebrating this many years in remission if I didn't follow my doctor's advice. And as I always say, I'm not a doctor, okay? I'm just expressing my experiences. And, vacations will always be there, okay? But honestly, you only have one shot at remission, okay? Your best bet is to keep pushing through, get to the end, and take all the vacations you want. Sorry, not the answer I know many wanted, but it's the best advice that I could give. Until next time, this is Paul's Heart.